Noah, thanks for agreeing to be a subject in our YouTube channel. So you hurt your finger?
Yeah.
Yeah. What did you do?
I was running and it caught on my friend and it went sideways.
Pulled it sideways, yeah. And it's swollen around the proximal phalangeal joint, quite sore.
Yeah.
So what you can do with these, I'm talking to the camera, what you can do with these, you can just, instead of x-raying, just go straight for your scan. Most x-rays of long bones, including finger bones, phalanges and metacarpals, are equally easy to see. Most fractures are equally easy to see on a scan as they are on x-ray. So sometimes you get more detail from a scan. So I'm going to have a quick look. So just use your own ultrasound. This is a little hockey stick, but just use your own handheld. There'll be plenty of detail. And just place it longitudinally on the bone. And you can see the gel here, skin layer, muscle layer, and there's the bone. You can see that, and and you can't see into bone, just reflection under there, so we're only interested in the surface. And we look back and we see a growth plate there, little irregularity at the growth plate there on the dorsal surface. There's the joint, and there's the end of the metacarpal, the fifth metacarpal. So just scroll up and down, have a quick look. Just using lots of gel, so I barely touch the finger, even though it's sore. It doesn't really hurt. Hey, know what I'm doing, yeah. So we go from the side. So here's the MCP joint again. That's the end of the metacarpal. Here's the proximal phalanx with the growth plate. And you can see there's a little kind of angle here. Kind of looks like a little wee buckle. And that's, I'd say, what that is. And we ought to be able to see that on an x-ray. We'll do an x-ray as well, and we'll look for the sort of same thing. We might talk a bit about the x-ray. This is a slightly subtle x-ray. One thing to remember when you're seeing children with sore limbs, sore wrists, or forearms, sore hands, is that even like especially Noah's age or younger, nearly always, if they've come in after a day or two and it's still sore, nearly always there's a fracture. It's only a question of whether it's going to show up on your x-ray or not. And remember, with children, things are often related to growth plates. If you look at the x-ray here, you'll see there's a question mark and an asterisk where the radiographer has indicated that there may be something going on. And indeed there is. If you look to the right of the question mark there's that the contour of the cortex as it goes down the proximal phalanx, and it sort of fans out or flares out a little bit as it approaches the growth plate. And that's not normally like that. You can look at the adjacent bone, or look at the other side of that phalanx, or look at the adjacent finger, and you see you don't get that flare, and that indicates there's a bony damage there. Normally it's actually a little Salter-Harris 2 rather than a buckle, so a tiny Salter-Harris 2 fracture, and you often can't see the cortex breach or even where the fracture runs. But just remember, if you don't see a fracture in a child, it's very likely that they may have a Salter-Harris 1. And this is definitely true of children with their wrists. If they're very sore over the growth plate, chances are they've got a Salter-Harris 1. It's certainly true for toddlers, when they get they jump off a height and they get a sore leg, they won't weight bear. If you don't see a fracture on their long tibia-fibia x-ray, there's still a 60% chance that they have a fracture that you can't see. But anyway, in this case, we can see a tiny Salter-Harris 2. It looks like a stable fracture. We're not very worried about it. But it's interesting to compare the x-ray and the ultrasound. And just looking at that little flare out there, you'll see that with a lateral ultrasound. So when you look from the lateral side, from the ulnar side of the wrist in this case, you'll see that, which is what we saw on the on the picture that we did. We also can look from the ventral surface. If you just turn your hand right over that way, from the volar surface there, a bit harder because the fingers sometimes want to flex up a wee bit when they're sore. There's the bone there, and you can see the flexor tendon on the top, and we can watch it working if we want to. Looks like a big eel. Easy to see. And we go back to the base of the bone, and that looks fine, doesn't it? There's the growth plate, that's the MCP joint. So you can look from those three angles. Obviously can't look from the radial side because the fourth finger's in the way. But it looks like we've got possibly a little buckle on the side. It might be a quiet sort of Salter-Harris 2 fracture right in there. Does that sound about right? Okay. Sometimes you can, you might get the sense with certain of these injuries you don't need to x-ray. Once you've got enough confidence and you've done enough times, there's enough research out there showing x-rays and scans pretty equivalent, or scan maybe even better. And you can use your scan as a screening tool whether to decide to x-ray or not, depending on your situation. Thanks, Noah.